Stem cell treatments have been of great interest, particularly recently, to many people with MS. So we thought that we should provide some background, a kind of framework in which you can understand these kind of treatments better. I think what's important is to think about two completely different types of stem cell treatment. The first one involves an attempt to harvest or get cells from somewhere in the body in order to specifically regrow myelin or make new nerve connections. The second one is what's referred to as autologous hematopoietic stem cell transplant, or AHSCT, sometimes also called autografts. And this second group is what's been in the media and what's become potentially available in Australia, in the Soviet Union, and privately in other institutions as well for treating multiple sclerosis. But I want to go back to the first one. So this is an attempt to grow stem cells from the nose, from fat, from a bone marrow cell called a mesenchymal stem cell, and inject them or infuse them into the body in the hope that these stem cells will then directly turn into the sort of cells that can make myelin and repair the myelin sheath inside existing MS lesions, or turn into nerve cells that will allow axons, the cables that might be destroyed in MS lesions, to regrow. Now, unfortunately, at this point, there's no evidence that this really works. Not in animal models, or at least only to a small extent in animal models, but definitely not yet in humans. I think personally that finding stem cells and growing them to produce myelin in the future may well be feasible, but these types of stem cell treatments at the moment should only be done in clinical trials where people are very carefully observed and monitored. Because there have been actually a couple of cases with mesenchymal stem cells, one in Egypt, one in Russia, where patients have got suddenly very substantially worse after they've had the stem cell infusions. In my personal experience as a doctor looking after many people with multiple sclerosis, I have seen many patients have this type of treatment in China, in India, in Mexico, in Germany, in Belgium, and I have to say that in the medium and long term I have never seen any of that actually provide substantial benefit to patients with MS. It's an area that scientists are working on very hard. It's also an area in which mice are very beneficial, because you can try various approaches to get the stem cells towards the myelin producing cell and to inject them or infuse them or somehow allow them to enter people's brains in these models. At the present time, though, I would stay away from it if it's offered to you. The second type of stem cell treatment is unfortunately named the same. We've got the word stem cell in there, but here the stem cells in autologous hematopoietic stem cell transplantation, or AHSCT, are actually blood stem cells. And what this really is a method for giving the body a lot of chemotherapy. Chemotherapy is usually used in cancer, and usually the limiting factor of how much chemotherapy you can give in cancer is effects on the immune system. This immune suppression is very profound, very significant with high-dose chemotherapy. So cancer specialists have learned a technique that is widely applied in cancer of AHSCT, where you actually can give so much chemotherapy that a person would normally die, because their immune system is largely wiped out. But what you can do is to store blood stem cells beforehand of that person and give these cells, infuse these cells back to the person after the chemotherapy in order to save their life and reconstitute their immune system. So this is a stem cell, only in the sense it's a blood stem cell. It's not a brain stem cell or myelin producing stem cell. So where is this treatment useful? Essentially, it's most useful in people who are failing existing MS treatments because of inflammation. So what I mean by that specifically is that if you're already on a very active MS treatment such as Lemtrada, Tysabri, Gilenya, and you're still having relapses and you're developing new lesions on MRI scans, if that is your situation, then this type of high-dose chemotherapy and stem cell transplant is very likely to work well. It's very likely to cause your disease to go into remission for years, hopefully 5 or even 8 years, although it will most likely eventually come back. The treatment is not yet widely available, although it's increasingly available in Australia and of course privately in many overseas institutions. The problem is that with this increased benefit for relapsing MS come increased risks. Those risks are the risks of substantial immune suppression. That is, you're much more vulnerable to viral and bacterial infections. These can be very severe. And you're also more vulnerable to autoimmune disease. This seems strange because MS is an autoimmune disease and we're treating it. But this very significant change in the immune system can unmask other autoimmunity. So people after bone marrow transplantation, after AHSCT, can develop an autoimmune attack on organs such as the thyroid gland or the blood. The problem is that in most good centers where a lot of the outcomes are reported well, this treatment does not work well for progressive MS. Progressive MS is usually not caused by the development of new inflammation or relapses, but by other processes which are actually not really fully understood or fully characterized yet. But the slow change in walking, slow change in coordination and bladder function that occurs in progressive MS has to date never been shown to be improved by any of the treatments that we have in multiple sclerosis. Not to date by fingolimod, by the interferon injections or other treatments when they have been tried. And it's really the same thing with AHSCT. AHSCT, in its various versions, is just an immunotherapy. And in my personal experience, as well as in these cases, numbers of cases that have been described all over the world, it doesn't work. People continue to progress, and in my view sometimes even progress at a faster rate. So, if you have severe uncontrolled relapse MS, with new lesions developing on scans, new relapses, then this might be exactly the right treatment for you. It may be worth the risk. If you have a form of progressive MS, it's actually very unlikely to work. Now this is difficult and even heartbreaking for many people to understand, but I personally now look after 7 people who've had this for progressive MS, and it hasn't worked in any of them. I'm currently looking after 3 people who've had this for severe relapsing MS, and it's worked well in all of them. And I think you have to remember that when you make the complex decision to go onto or engage in a really quite dangerous therapy.